From the American Association of Nurse Practitioners, I'm your host, Dr. Sophia Thomas, and this is NP Pulse, the voice of the nurse practitioner. Welcome to NP Pulse, AANP's official podcast, bringing you unique nurse practitioner voices and issues that matter to NPs and to our patients. Anxiety is the most common mental health disorder for both adolescents and adults. While anxiety disorders are very common and prevalent, their conditions and symptoms are often under-recognized and undertreated, especially in the adolescent population. Joining us today on NP Pulse to discuss this important topic is Dr. Shonda Phelon. Welcome to NP Pulse.
Thank you. I'm so happy to be here, Sophia.
Well, I'm so glad you're here. We are going to be talking about a very important and I think really prevalent topic, which is anxiety. But before we get started, I'd like our listeners and viewers to get to know you. So introduce yourself.
Okay. My name's Shonda Phelon. I've been a nurse practitioner since 1992, so right about 32 years. Primary care the whole time. But starting, I guess, in about 2006, I've been working psych mental health. I've been teaching for the last 15 years, and I'm a professor of nursing and the program chair for a graduate family nurse practitioner track, DNP and MSN.
Wow, that's a lot. And where do you teach?
Mississippi University for Women.
Oh, great. Wonderful. Mm-hmm. Well, how did you get involved? You said you started as an FNP,
right.
And then you ended up moving into psych mental health as well, and I know there's such a need.
Right.
What gave you the interest to really focus on anxiety? I know you're a nationally known speaker about anxiety.
Yeah. Well, it's just so prevalent throughout practice, whether you're in family practice, peds, geriatrics, whatever. Anxiety is the most common diagnosis that we have in mental health. So a lot of our students and colleagues would have questions, often have questions, and to me sometimes it would seem like simple things. So I teach that content to our FNP students, so I decided that I wanted to just share, my knowledge with other folks and just give people the tools to treat folks where they are.
That's great. And, we do have a shortage of psychiatric healthcare providers across the nation. Yeah. So I think it's so important that those practicing in primary care do have an understanding about anxiety and diagnosis and treatment, et cetera. So you do teach that, and I know one of your presentations is called the Sunday Scaries.
Yes.
What are the Sunday Scaries?
Actually, I learned about the Sunday Scaries a few years ago. Dreading Monday's always been a thing, I guess, for all generations. Well, my daughter's a little older now, but they're younger millennials, I guess you'd say, or older Gen Zs maybe, but they were planning to go to church one Sunday afternoon, and I'm like, why church on a Sunday afternoon? And she said, well, if we have activities on Sunday afternoon, it prolongs the weekend, the Sunday Scaries don't set in. She said, when you finish your day kind of early, then you've got all afternoon to dread the week. So I got to thinking about that, and I'm like, why? She's very successful, great job, probably about 25 at the time. Just lots of anxiety about that, going to work that Monday morning. Great boss, she's still got the same job, But so it got me interested in maybe using that as a topic and kind of to draw people's attention and make them want to come hear me talk about anxiety.
Well, that's great. Well, I understand the Sunday Scaries. Every Sunday, my husband and I sit on our back porch and we say, oh gosh, tomorrow's my day, and what are we going to do this whole week? So I understand that, and I know students and young adults, this is very prevalent, right?
It is. Anxiety is the most common mental health disorder, and it's really rampant in the younger population, adolescents, young adults, the 20-somethings. And if you think about it, they've grown up in a really troubled world. I mean, starting back to 9/11, my girls were probably 5 and 6, but they still remember that. And, their lives got disrupted. And then it's been one thing after another. COVID, social media, 24/7 news. There's just lots of stress and pressure. And social media, I think, has caused a lot of anxiety because it presents a perfect world, and that's not the world. So one of the statistics I saw that was in 1985, when I would have been a freshman in college, only 18% of college freshmen felt pressure to succeed. But fast forward to 2014, it was like 40%.
Wow.
And they've not updated that statistic recently, but that was just very impressive to me, thinking our world has really changed.
Our world has changed.
Teaching in university, I deal with a lot of young adults, and a lot of those nurse practitioner students were in nursing school during COVID, so their experience was not necessarily like a traditional nursing student would have been. So they're coming in with a lot of fears, anxieties, self-doubt, not knowing if they really can measure up to doing graduate school, so they stress themselves out before they get started sometimes. And a lot of my interest came from helping them, as an advisor, program chair, professor, just wanted to kind of help them. Or our colleagues run a student health center, so a lot of those students will go there for treatment. So just helping my family nurse practitioner colleagues, knowing how to treat them best, also, kind of helped spur my interest.
So what are some symptoms of anxiety? I know there are the traditional ones where you can clearly tell someone is anxious, but
Right.
the symptoms vary, right?
Right. Some people can just sort of zone out, not speak, not talk because they're so anxious. So it may come across as being uninterested, uncooperative, but they just have that fear. They're kind of stuck. Also, there can be, GI symptoms, restlessness, not sleeping well at night, just a variety of things, not engaging in social activities, staying at home, withdrawing, just not participating. And of course the regular things like fast heartbeat, sweaty palms, fidgeting, all of those traditional symptoms that we think of.
Mm-hmm. So some of the symptoms of anxiety can kind of appear as if it were depression, if they're being withdrawn.
Right, it can. And the great thing is they're treated very similar. So in my practice, I focus on symptoms. So when I'm looking at meds, I look at meds that are going to target those symptoms. So if somebody's not sleeping, or if somebody's anxious, or if they're, worrying a lot, I try to focus on meds that are going to help those symptoms.
So if I'm in primary care, obviously you are a psych mental health NP. Mm-hmm. You probably use the DSM criteria and diagnose your patients that way. Mm-hmm. For somebody in primary care that may be less familiar with the DSM, what would you recommend they do as far as screening for anxiety?
There's lots of screening tools that are very helpful. The GAD-7 is probably one of the most common ones used. And we actually teach that criteria, the DSM criteria, to our FNP students. But, they have it, in their handouts and that sort of thing. But lots of good screening tools out there.
Okay, that's great. And then I know you mentioned to me before, you're a medication minimalist. What does that mean?
Well, first of all, I really like to, assess my patients, get that history. And because some anxiety is okay. Mm-hmm. Moderate levels of anxiety provide the best function for somebody. Low levels of anxiety keep you from performing. They sort of make you not want to do. Extreme levels of anxiety paralyze you and you can't perform, but moderate levels are okay. So I try to, really talk to patients and see, is this something you can manage with some coping skills? Do you need to incorporate exercise? Do you need to talk it out? And sometimes just admitting that you have anxiety will help. And then the lowest amount of medicine to target those symptoms if that's what we need to do.
Okay. And I've heard you talk about normal anxiety versus disruptive anxiety. What is disruptive anxiety?
Disruptive anxiety is where you can't fulfill your obligations, like not going to work, calling in sick on Monday, not going to school, not preparing for a test and then failing, social relationships, not engaging, having a fear maybe of social situations and not going, and then worrying about being left out or not being included, but not making a point of going, just total disruption in life. And then when that happens, oftentimes the person will not have joy and pleasure, which really can lead to depression.
Mm-hmm. Okay. And you talk about, we're talking about young adults and students and things like that. How does anxiety in the young adult differ, if it does, from older populations?
More so the life experiences. Older people have probably experienced it, because I think at least a third of adults have some sort of anxiety, a third of people. And it's one of the most common presenting symptoms. So the difference is sometimes adolescents and young adults can't really put it together to get those coping skills because they don't have those life experiences, and it's overwhelming. So they just don't know what to do. So oftentimes they do need a healthcare professional to work with them on what do I need to do? Do I need therapy? Do I need meds? Do I need better coping skills? Do I need to incorporate exercise? Cut out my caffeine, cut out my social media. What do I need to do to get better?
Okay. And you mentioned social media. I think it's hard for a lot of people to
Very hard.
Get rid of social media.
It's hard for me, so I know it's hard for them.
Exactly. And our young population has grown up on social media. They've had phones in their hands since they were 6 or 7.
Right.
So you mentioned the perfect world that social media prevents. We're looking at the perfect world of everybody else and then comparing our lives to what we see on the screen. How does that trigger anxiety in people when they see these things?
The pressure to succeed and have that same thing, I know my daughter, when she had her first child, she was like, you look on here and you see the moms, and they're all dolled up with their makeup on, their hair done, and they're looking
right
great.
Out of the hospital.
They've lost all the weight. Yeah. And here I am just trying to, fake it till I make it. That's what was her very words, not... and just feeling that pressure, the posting the pictures, constant pictures, and everybody looks great, but we didn't see the 15 pictures it took to get that one good picture, and that kind of thing. So I just think educating and say, remember, this is not, real world, and there are some bloggers, I think, that are great to help that because they will post the real world of being a 20-something mom with a toddler, or a newborn, and what it's really like.
Yeah, and I think that's the reality is what we need to share with people.
Yes.
I was listening to a podcast not long ago, and the one of the guests was saying that they don't let their children have social media in their house. The kids go outside and play, like when you and I were kids.
Right.
We went outside to play, we were running in the hills and things like that. And when those children engage with other children who also don't have social media, whose parents agree not to, those children are living lives like we did when we were children.
Right.
But he said when his children engage with other kids who have the cell phones and have social media, those children have a hard time putting the phones down.
Right.
When they're expected to go outside and run and play, they don't know what to do because that's not something that they grew up with. And so you can see the difference in probably the anxiety levels even in young children.
Yes, I think so. And I think it's so important to have, those organized activities, team sports, things like that where you don't have those phones. But, it's hard. It's hard for us to let go of our phone. And then, if I had a child now in school, I'd probably want them to have a phone just because of all that's going on in the world, and different tragedies. So it's very difficult. And I think we have to model that behavior to our kids and young adults. Even as a college instructor, we find ourselves carrying that phone with us, and then we wonder why they have it on their desk and they're picking it up while we're lecturing. But we need, we do the same thing. So we've got to model better behavior, I think.
Okay. And you talked about a lot of different coping skills. What do you find is the most effective thing to teach patients as far as coping and dealing with their anxiety?
The first thing I like to do is normalize anxiety, normalize it, and they don't feel like they're a condition. They feel like, okay, this is what happens to me, and I can manage it. The first thing I do is try to really look at relaxation techniques, whether it's listening to music, deep breathing, just relaxing, go into that safe space, and then exercise, really encouraging exercise and physical activity to increase those natural endorphins. Mm-hmm. And I think that's very effective. Limiting caffeine, limiting simple sugars, and that's hard to do when you're busy, you're in college, you're in school, you're running around, going through the drive-thrus. But those are the big things I like to really teach.
Okay, and those are good. And you know what? We recommend diet and exercise for every healthcare condition.
Yeah.
I mean, we realize the value of nutrition and exercise on the overall health and wellness of our body.
And I really try to focus on, what do you like to do? So if they say, I like to shoot basketball, well, get out and dribble the basketball and shoot it. Or, I like to ride my bike. Well, bike ride this many times a week, and try to make it more prescriptive than just encouraging exercise, get specific in what I want them to do.
Yeah, and I've actually written prescriptions for, go to the gym 3 times a week, and here's your prescription.
And with any positive behavior, I think all the studies have shown that the more we, as the healthcare provider they choose or recommending it, the more likely it is to happen. It may not happen that first visit, but if we keep hammering away, eventually it will come through.
Mm-hmm. Absolutely. What would you say? You mentioned anxiety, coping mechanisms, and treating it that way. As a primary care provider, if you were to recommend for me next steps for treatment for patients?
The SSRIs, the selective serotonin reuptake inhibitors, are first line. And there's multiple meds in that class that are affordable, generic. Those are my go-tos. That's what I start with. Usually for that adolescent and young adult population, the tried and trues are like the sertraline, paroxetine, fluoxetine, and those are my go-tos.
Well, this has been a fascinating discussion. I really appreciate you taking the time.
Thank you so much.
Anxiety is, as you said, the most prevalent behavioral health disorder, and I think it's important for everybody to understand the symptoms. And people don't think about some of the symptoms that you shared are not what we would consider the typical anxiety symptoms. Mm-hmm. So those feelings of being withdrawn as well, that person may not have depression, which is what we would traditionally think with withdrawal. They may actually have anxiety.
Right.
So thank you so much for sharing.
You're welcome. I enjoyed it.
That's great.
Thanks.
Thank you for joining us today on NP Pulse. I hope you enjoyed our guest today and learned as much as I did. Please subscribe to this podcast, share it with your friends and colleagues, and check back regularly for new episodes. And as always, be kind, be safe, be effective, and be the voice of the nurse practitioner.